I am Dawn Hayes, and I am presenting today on Pivotal Response Therapy, a pathway to lifelong success for those with autism. A few little markers about autism that is widely known is that those with autism oftentimes have trouble with social interactions, initiation, motivation of those social interactions, and motivation to actually talk. The Diagnostic Statistical Manual of Mental Disorders, the fourth edition, said that Asperger's is a deficit in social function, and the fifth edition actually said that communication and social exchanges are so closely related that they're hard to differentiate from. And as we know, that those with autism actually have trouble even knowing about social norms. And this actually affects family relationships, social relationships, and later on in life, working relationships. Asperger's, those with Asperger's often have trouble, like I said, with social times, social interactions, and about half of people with Asperger's actually have no paid job experience and no secondary education even 2 years after high school graduation. Later on, after 7 years, the number actually goes up a little bit, but only 1 in 3 still have that no job experience and no post-secondary schooling. And also, it is known that people with autism face a lot more challenges because of their social inabilities, and that a job presents an unpredictability, which is also going to lead to stress. Pivotal response therapy is an applied behavior analysis. You use specific teaching skills to teach new skills to these students. It was developed by Drs. Robert and Lynn Cagle, and this was over about 3 decades. And what they mean by pivotal is those are the needed skills that someone is necessary for someone to be more successful, especially in areas of social situations. But pivotal response therapy focuses on motivation, responding to cues, self-regulation, and self-initiation. With pivotal response therapy, you have to have something that the child's interested in. Like, let's say, for instance, they enjoy swinging, and you're trying to get them to say the word swing. Well, what you're going to do is you would let that child engage in the activity just a little bit, like swinging, and then you'll stop them, and you'll prompt them to say that word, swing. And so you don't really want to reward just any old attempt or even just noises, because otherwise they're going to learn how to just get that response with just the noise. You want them to actually say the word swing. And so again, this part, them actually saying the word, it's probably going to take a while. But any worthy attempt, you want to reward with that specific item or activity. So if the student or person says swing, then you want to let them swing. Or if it's a bear or anything like that, you want to make sure that that is the object that they get. It can be one-on-one between a teacher and a student, or it can be between a parent and a student. You can do it as a routine in the classroom. The prompting aspect of it, though, you have to keep prompting that student until that student actually starts responding the way that you need them to. Again, you want to reward the student with those for those worthy attempts, not just any old attempt. And you want to reward them with whatever it is they're after. And visual cues are a must. The rewards of pivotal response therapy: there is academic rewards, social, communication, behavior, peer relationship. There's going to be improved relationships with parents, with other members of the family. And actually, and I thought this was really interesting, there is improved brain activity associated with sociability and communication. So as we can see, pivotal response therapy improves not only those social skills, but physically will help that student develop in their brain. And these are my references. Thank you very much for your attention.